Prior authorization. Just the term might make you feel like you're jumping through hoops. But if you're treating Medicare patients, it's part of the job. Let's walk through exactly what you need to secure prior authorization for Jardiance, a critical medication for managing type 2 diabetes and cardiovascular risk. So why does Medicare require this extra layer of authorization for a medication like Jardiance? Medicare's goal is to ensure that high-cost drugs are prescribed to those who truly need them, not to add more work to your day. But with the right approach, you can make the process work smoothly for you and your patients. Jardiance is a Tier 3 or Tier 4 drug under Medicare Part D plans. These tiers mean higher copays and often prior authorizations. Medicare wants to confirm that this medication is truly necessary. And with the rising costs in healthcare, it's a measure to keep resources allocated efficiently. Jardiance, or 𝗗𝗶𝗶𝗶𝗰𝗿𝗲, is a powerful tool for managing type 2 diabetes and reducing cardiovascular events. It's an incredible option, but Medicare requires that we justify its necessity because of its high cost and specific usage. So they want evidence that it's appropriate for each patient. That's where we come in as providers, equipped to prove that it's the best choice. Let's break down each step of securing prior authorization for Jardiance, from initial prescription to final approval. Step 1. Initial prescription and documentation. Start with the basics. Get the prescription and gather all supporting documentation to build a strong case. Include diagnosis codes like E11.9 for type 2 diabetes and I50.9 for heart failure, relevant lab results like 𝗗𝗵𝗋𝗂𝗶𝗋, and a summary of past medications tried. Medicare wants to see a clear history and rationale for trying Jardiance. Step 2. Submitting the prior authorization request. Each Medicare Part D plan has its own submission process. Some offer online portals, which is often the quickest route, while others accept fax or email. For Medicare Advantage plans, always double-check requirements to avoid delays. Step 3. Completing required forms and attaching supporting documents. Next, fill out the statement of medical necessity. Describe why Jardiance is the optimal choice, why other treatments fell short, and what health benefits you expect it to bring. This is your chance to tell the patient's story and why this medication is crucial. Step 4. Awaiting the decision. After submission, you'll usually get a response in a few days to a week for non-urgent requests. Medicare also offers expedited review if the patient's condition is pressing. During this period, be proactive. Check online or by phone to make sure nothing stalls the request. Step 5. Handling approval or denial. When you get Medicare's decision, either go forward with the prescription or, if denied, take advantage of the appeals process. Often, denials are due to missing information or insufficient documentation. Don't let that stop you. Review the denial, gather any additional data needed, and resubmit. Make sure your ICD and CPT codes are accurate. For Jardiance, you're likely using ICD codes like E11.9 for diabetes or I50.9 for heart failure. These codes help Medicare understand the conditions you're treating and why the medication is necessary. Navigating Medicare's prior authorization process for Jardiance can feel like a burden. But with thorough documentation and attention to Medicare's guidelines, you can make the process smoother for yourself and your patients. In fact, many practices find outsourcing solutions like those from Staffingly help save up to 70% on costs and free up internal resources. Staffingly's team handles prior authorizations, insurance verifications, and other essential tasks, allowing your staff to focus on patient care. Reach out to Staffingly at 800-489-5877 or support@staffingly.com. Remember, while this guide provides a helpful overview, it's always best to check directly with Medicare or consult a professional for your practice's specific needs. This information is meant to support healthcare providers in understanding the prior authorization process, not as a substitute for professional advice. By understanding Medicare's prior authorization requirements, we can stay focused on what matters most, providing top-notch patient care.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.